it's got us all thinking about the future, and we're really excited about where this technology could lead. The way we've chosen to implement PACS and RIS has allowed us to become essentially a filmless department overnight. What we want to do now, what we are seeing the potential for, is to go completely paperless. The way we manage it at the moment is that when paper request forms for our services come from referrers, we use a flatbed scanner and scan them into the RIS system. But the next step, the step to avoid illegible or incompletely filled out request forms, would be to have complete electronic requesting. So we're pushing very hard with the national programme and with our local IT department and Connecting for Health in the Southern Cluster to get us some order communication software to work with our PACS and RIS system so that we can go the extra mile and become completely paperless. That's going to give us lots of challenges inside the organisation in helping our clinicians and other referrers to manage without the paper on which they've become highly dependent. But there are lots and lots of benefits for patients, for safety, for clinical governance that will result from an efficient implementation of electronic requesting to go along with electronic reporting. We want to use voice recognition technology to the degree that we feel it's capable of assisting our work. The technology itself is splendid. We need to continue to work with the developers on the integration interface with our radiology information system to get the absolute most out of it. If we're to realise all the benefits in terms of reduced costs of staffing and staff redeployment, then it's essential that this work is taken forward. The third thing I would refer to in terms of the future relates to the ability of organisations such as ours to exchange images on patients with other healthcare providers. We, being a tourist area and being an area where we have a lot of transient population, we're frequently getting patients in here in an acute setting where their previous imaging is held elsewhere, and that can result in frustrations and inefficiencies in their medical management. When we have a functioning national spine, then we'll be able to retrieve their images from sent elsewhere, wherever that might be in the United Kingdom, and thereby manage their condition in a more timely, efficient and correct fashion than we always are at the moment.